Hello, everyone, and good evening, and welcome back to another series of Plant-Based Health Professionals UK live CPD accredited webinars. It's so exciting to be back after the summer break, and I've been looking forward to this webinar personally for a really long time, where we're going to be discussing a physician Previvor's journey from breast cancer awareness to action with lifestyle medicine, with Dr. Simran Malhotra, who is currently across the pond, but very kindly joining us in the middle of her day. So just before we get started, I just want to flag that we have an amazing lineup of webinars coming up, and the next one is already up on our website, and it's with Soraya Pineda, who's a registered dietitian, and she's going to be discussing weight management on a plant-based diet. Now, this is a really hot topic, especially with the new, the drugs that are kind of getting a lot of media attention, such as Ozempic or the GLP-1 out there. So she's going to be discussing the strategy she uses with her own clients in the tier 3 weight management service she runs in the NHS, as well as with her own private practice. And she's going to be talking about how to optimize weight management while following a plant-based diet, which is relevant for so many people, whether you're vegan or you eat a plant-predominant diet. Hopefully you'll come along and learn some tips from this. So do share that with everyone, because our webinars are open to absolutely everyone, not just health professionals and not just members of ours, but our recordings are for members only. And for those of you who don't know me, my name is Rahini Bajekar. I'm a nutritionist and board certified lifestyle medicine professional and the communications lead at Plant-Based Health Professionals UK, which is a community interest group dedicated to promoting healthy, whole food, plant-based nutrition for human health as well as planetary health. We're very lucky to be supported by the British Society of Lifestyle Medicine, who provide us with CPD accreditation, and the American College of Lifestyle Medicine, who provide us with CME accreditation. And everyone who attends will get a certificate in their inbox in a few days' time. And also to veganfitness.com, who kindly lend us their Zoom platform. Do consider supporting our work and advocacy efforts. You can do this by joining us as a member. This is open to everyone around the world, and our membership starts with as little as £25 a month for general membership, £25 a year for general membership. And you can visit pvhp.uk to subscribe to our free weekly newsletters and donate via pvhp.uk/donate if you enjoyed this webinar. And do also follow us on Facebook, Instagram, and Twitter. And also Simran, who is about to give this evening's talk. I'd like to welcome Simran. So Simran is a triple board certified a physician. She's a palliative care expert, and she's going to share her incredible personal story of healing, as well as loads of practical lifestyle tips, which hopefully you'll share with your friends, family, patients, and colleagues. So over to you, Simran, and I'm really looking forward to joining you for the live Q&A as well in about half an hour. Oh, Simran, you're muted.
Sorry. Okay. I am here and I'm just going to share my screen. A minute. All right. So, all right. So let's get started. So thank you for having me. I'm very excited to be here. Today I have a lot of things to share with you, so I'm going to try to get through as much of it as I can so that we can chat at the end. And these are some of my goals for today. We'll talk a little bit about breast cancer, specifically the role of genetics, lifestyle medicine, and just some actionable ways that we can reduce our risk of breast cancer. But the first question is, why is a palliative care doctor here to talk to me about breast cancer and lifestyle medicine? So a disclaimer, I am not a cancer expert. I'm also not a breast expert. However, I have been around a lot of cancer in my life, personally and professionally. And so today I hope to share with you not just some facts about breast cancer, but also some of the teachings from my own personal journey. And it's perfect because it's Breast Cancer Awareness Month in October, or as I like to call it, Breast Cancer Action Month. And so today we'll talk about some breast cancer education, my story, and throughout all of this, I hope that it empowers you with knowledge and some steps to go forward to take into your own life. So Cancer and I first met when I was 13 years old. My mom was 33 when she was first diagnosed with breast cancer. At the time, we thought, okay, this is very odd. She's so young. She didn't really have any risk factors. We just thought it was bad luck. She got treated and we kind of closed that chapter and moved on. That was until 2014, and fast forward, I'm now a medical resident, and someone very, very close to us in our family got diagnosed with a very serious form of ovarian cancer. And this, for me, as a medical resident now, was a huge red flag. And I started diving into my family's history, trying to figure out, who else, what else, where is this coming from? All of the questions. Started talking to some of my, oncology colleagues. And at that point, they basically recommended that my mom should get genetic testing again. And she did. And she actually found out that she carried the BRCA1 genetic mutation. We'll talk a little bit more about what that means in a minute. And shortly after that, she ended up getting a preventative total hysterectomy to reduce her risk of ovarian cancer. And to date now, about 9 to 10 women on my mom's side of the family have had either breast or ovarian cancer. So we have a very, very strong family history. And my mom's actually now a 2-time breast cancer survivor. She found out again in 2017 during routine screening that her cancer had come back after 15 years. And so she ended up having a bilateral mastectomy at that time. So bringing it back to me, in 2015, I was a third-year medical resident and just about to get married. I decided to pursue genetic testing because of my mom's results, and so my husband would know what he's about to get into. And I found out that I also carry the BRCA1 genetic mutation. What is BRCA? So I've said it a few times. It is a gene that we actually all are born with, and it's actually a tumor suppressor gene. It is the gene specifically that prevents us from getting breast and ovarian cancer. So they're protective genes. Now, when you have a mutation in this gene, that's when you have a significantly higher risk of getting breast and ovarian cancer specifically, but also a few other cancers like pancreatic and prostate. So because of my genetic mutation and then also the family penetrance, my lifetime risk of breast cancer was 87%, an 87% lifetime risk of breast cancer, and then a 50 to 60% lifetime risk of ovarian cancer. So I'm going to take a pause because the next several years of my life are filled with doctor's appointments and screenings and all sorts of things. So I'll get to that in a minute. But who gets breast cancer? So breast cancer is the most common cancer that's diagnosed in women after skin cancer. It's the second leading cause of cancer death in women after lung cancer. And I think what I want to point out on this screen is that it's most common in women, but men can get breast cancer too. And at least in the United States, about 1 out of every 100 breast cancers is diagnosed in a man. And overall, if you're going to get a cancer, breast cancer is a good one to get, just because overall a lot of research goes into breast cancer and our treatments have been advanced. There's great detection with screening and all the modalities that we have. So there's a lot of improvements in the outcomes because of this. So when you look at the average risk of breast cancer, so I talked about someone like myself who has a genetic mutation, but if you look at the average woman in the United States, 1 in 8 women, which is a 12% lifetime risk of breast cancer for the average person. So non-modifiable risk factors. So these are all the things that we can't really change, right? So females getting older, if you have a strong family history like I talked about, or if you have an inherited genetic mutation like I do, if you have a prior history of breast cancer or atypical lesions, if you've had a diagnosis of, say, a lymphoma and yet to have thoracic radiation, that would be another risk factor. Increased breast density, certain ethnicities, and then reproductive history. For example, if you were before the age of 12 when you got your period, or you were older than 55 after menopause. This is something that I think most people don't talk a lot about, so I thought I'd put it in here. And I won't go through every single one of them. You can always review this afterwards, but these are the red flags that you should think about for hereditary breast cancer. one thing to point out here is that not all genetic mutations are created equally. And because of the advancements in gene testing now, we have found many different types of genetic mutations. When it comes specifically to breast cancer, BRCA1 and 2 make up about 50% of all hereditary breast cancers. And then you have what we call high penetrance genes and moderate penetrance genes, meaning BRCA1 is a high penetrance gene. It carries a much higher risk of getting breast and ovarian cancers versus some of the lower or moderate penetrance genes, for example, things like PALB2 or ATM or CHEK. So not all genetic mutations are created equal. And I think that's just really important to highlight. So again, these are all of the different things. If you see this in a person or a patient, it should really make you think about a possible inherited genetic mutation, and that person can then pursue genetic testing. So personally, for me, the year that I found out about my genetic mutation, I was also just about to start my fellowship in hospice and palliative care. If you're not familiar with palliative care, it's essentially a field of medicine where you care for people living with serious illness, oftentimes at the end of life. As you can imagine, this was an extremely challenging time for me because I was trying to navigate what this mutation means for me in my future, while also caring for people living with advanced diseases like cancer, some of whom even had the same genetic mutation as me. And so for me, I was, starting this patient journey and meeting all sorts of doctors and genetic counselors and surgeons and discussing preventative surgeries and medications and mammograms, and along the way had to have some biopsies because of suspicious lesions. And it was just this whole new world to me. And I felt so out of control in my life. For the first time, I was 26 years old. And there was one question that I kept asking almost every single provider at every single visit. And that was, what can I do to control my own risk of breast cancer? Like today, like I can do surgeries, I can do all these things, but I'm 26, I'm about to get married, I'm not ready to have kids, I'm not ready to have preventative surgery. So what can I do today, for example, with my lifestyle that's in my control? And it was literally pure crickets. Nobody had anything to say. And if they did, they mostly said, well, you have a genetic mutation. There's nothing you can do. You're just at a really high risk, other than these surgeries. And that was until later that year. I was on a hospice rotation and I was taking care of this one lady who had advanced ovarian cancer. She was in her 40s. She also had the BRCA1 mutation. And a few days before she passed away, she found out, I think, from her sister that I also carry this mutation. And she held my hand one of the days I was sitting by her bedside, and she said, Simran, don't let this happen to you. Do whatever you can, whatever you need to do to live a full life and be there for your future children. You have a choice. And in that moment, I had no idea what she meant. It's just something inside of me lit up, and I knew that there was something I could do. I just had to figure out what it was. And so here I was, 26 years old, and in my head, I had 5 really big, important things to do in the next 7 years before I turned 33, which is when my doctors wanted me to have these preventative surgeries, because that's when my mom was first diagnosed. So I had to finish my medical training. I had to get married. I had to get pregnant. I had to have children. I had to be sure I was done having children. And then I had to have these preventative surgeries. So it was a lot, as you can imagine. Some days felt impossible. There was days of paralyzing fear and anxiety, a lot of tears, many days, especially depending on who I was caring for that day. And several months later, here I was, a newly graduated palliative care physician, and also blessed now to be a full-time working mother, breastfeeding and pumping at work and chronically sleep deprived, and all the blessings that come with motherhood and working, and also seeing my cancer team and, getting screenings strategically between pregnancies and breastfeeding. And again, another blessing of intentionally getting pregnant when my firstborn was just 9 months old. And this was specifically because of the very strategic 7-year plan I had created for myself. It was a very, very hectic time of my life. And I think that voice was in the back of my head more so at this point than ever before, because I had zero time for self-care. Like, I was at the bottom of my totem pole in my life. You know, my kids, my husband, my family, my patients, my work, everything came before I did, and I was drowning. And so one late night on Google, I was just searching, and I came across this book, How Not to Die by Dr. Michael Greger. And what I learned was absolutely mind-blowing. In the first chapter, I read about Dr. Greger's grandmother, who was 65 and diagnosed with end-stage heart disease and sent home on hospice care. And she, I guess, did not accept that. And she ended up seeking out a program, intensive lifestyle program, went to that program and reversed her heart disease, and ended up living another 30 years and dying in her 90s. I read this chapter and reread this chapter and reread this chapter, I think at least 5 times that night, because I thought it was delirious. It was in the middle of the night. It was incredible, because I was a palliative care physician, and as a family member who has seen so many chronic illnesses, from heart disease to cancer, and I'd never heard this before. And I've seen severe suffering. I've seen suffering from symptoms like pain, and I've seen isolation. I've seen people lose their independence, their quality of life, and I've seen them die. But I'd never heard this before. I'd never heard that there was something that they could do, even in the setting of advanced illness, to not just reverse disease, but just do something to improve the quality of their life. And that was the essence of what I did as a palliative care physician. But I'd never heard this science before. So to me, it was mind-blowing. And this was a turning point for me, and not just in my career, but just my whole life. And this is where my genetic mutation actually became my biggest blessing. And so here I stand today, and looking back, reflecting on the last several years, after a lot of research, a lot of personal growth, after pursuing a lot more education and certifications over the last 7 to 8 years. And out of everything that I learned, what I realized was that there's only one thing that I can control in each moment, and that is my state. And our state, this is a whole talk on its own, so I'm not even going to go into the details of this, but our state is essentially the way that we show up in the world, for ourselves, for our families, our patients, everybody else. And our state essentially determines how we feel in any given moment. And there's 3 things that determine our state. It's our physiology, our focus, and our language. And just to briefly touch on focus, it's all the things that we focus on. It's the type of questions that we ask ourselves that determine, you know, our focus. Are we asking ourselves empowering questions or disempowering questions? It's the core beliefs that we have about people, places, and things. It's essentially our model of the world. And one of my beliefs has now become that we don't experience life, but we experience the life that we focus on. And language is very closely tied into that, because the language is the words that we use to describe the experiences in our life, and then the meanings that we associate to those situations. And the reality is, and I can tell you as a palliative care physician, that we will all experience difficult situations in our life. No human being is spared of that. And so this whole piece of it is not about toxic positivity and always thinking about good and positive and all of that. It's the power of and. It's the power of acknowledging how hard your situation in that moment may be, and all the feelings that come with it, and processing those emotions, and being intentional about where we put our focus and the language that we use to describe our situation. And then the main star of this whole triangle is our physiology, and that's the bottom. And our physiology is largely influenced by our lifestyle, and it's everything that we do with our physical body. So these are the best way to describe, you know, physiology is really the 6 pillars of lifestyle medicine. It's the way we're moving, it's the way we're eating, it's the way we're sleeping, hopefully the substances that we're not using, the way we're managing our stress, and the people that we choose to surround ourselves with. All of that affects our physiology, and adjusting even a single one of these things can change how we feel, sometimes even, in an instant. And not only do all of these things improve our quality of life, or have the potential to improve our quality of life, but they also carry the tremendous possibility of reducing our risk of chronic diseases, things like breast cancer and heart disease. And the beautiful thing about all of these pillars is that for the most part, they're in our control. And so for me as a doctor, this was a huge eye-opener, because I did not learn about any of this in medical school. I did. I mean, yeah, the first, line of treatment for cholesterol is, lifestyle changes. And that's what I told my patients when I was a resident in internal medicine clinic. And then 6 months later, they would come back and now their cholesterol is worse. And it's because I didn't actually know what I was saying. I didn't have any, I didn't know the science. I didn't know the actionable tips to help my patients to actually bring, that to life for them. And so that's why most doctors aren't aware of it. And so when lifestyle medicine actually found me when I became the patient, and it's changed everything for me. The one thing that I learned in palliative care, though, over the last 7-8 years that I've been working in it, is that one of the things that we hold as human beings, hold really, really close to our heart, is our autonomy and the ability to have control not only over our body, but just over our life and our circumstances. And when you get a diagnosis of a cancer or a serious illness, or a genetic mutation for that matter, you're stripped of a lot of your normalcy and a lot of your autonomy. And the beautiful thing about lifestyle is that it allows you to control so many of the things in your life that are just the smallest things, but it gives you back control in a situation where you may otherwise feel very helpless. And I'm speaking from personal experience here. And I think what's important to remember here is, sometimes when you look at these pillars, it can be really overwhelming to think about all the things that you need to do, especially in our modern world where we're all so busy. But I think what's important to remember is that it's the small actions, the one thing that we are focusing on in this season of our life that is possible for us, or the couple of things that we're prioritizing. And it's going to look different for everyone. And there is absolutely zero perfection in any of this. It's all about progress. And the truth is, it's the progress in anything in life that brings us joy and happiness. So it applies to our lifestyles as well. So I wanted to highlight this screen because I've heard so many times from patients and just people in general, oh, well, I'm going to get breast cancer, or I'm going to get diabetes because it runs in my family. And so I don't really have any control. And the reality is, specifically when you look at breast cancer, but this is true for most diseases as well, that only a tiny fraction of cases are actually as a result of an inherited genetic or hereditary mutation. And majority of cases are actually sporadic, meaning related to external exposures, things like environment, things like lifestyle. And so it's not diseases that run in families, it's actually lifestyles that run in families. And I think that's a really important point of empowerment as well, because we have more control over our risk of disease and our future than I think we're often led to believe. So we're going to talk about a couple of actionable tips now. So these are some of the modifiable risk factors, and we're going to get into it on this slide. So I'm not sure how many of you have heard about the American Institute of Cancer Research, or AICR, and the World Cancer Research Fund. They have collaborated, and they put out these reports on each cancer. This one is just their overall cancer prevention recommendations, but they have very detailed reports on very specific, cancers on their website. And they make these recommendations based off of these extensive systematic reviews that they do on like all the global research on how does diet and nutrition and physical activity affect cancer risk and survival. So when we talk specifically about breast cancer, for premenopausal breast cancer risk reduction, there is strong evidence that being physically active reduces the risk of both pre and postmenopausal breast cancer, actually, and limiting alcohol consumption and tobacco. So that's the substances that we were talking about. We know that both tobacco and alcohol increase risk of pre and postmenopausal breast cancer. Being a healthy weight is exceptionally important when it comes to breast cancer. We know that adult weight gain and excess body fat increases risk specifically of postmenopausal breast cancer. And then when you look at these four things, so fast food, ultra processed foods, processed meats, sugar sweetened beverages, while these things are not directly linked to breast cancer, what we know, or the way that I like to look at it, is that they're indirectly linked to breast cancer. And the reason I say that is because they're high in saturated fat, high in cholesterol, high in a lot of things that can increase weight gain and body fat. And again, weight gain and body fat are directly linked to breast cancer. And so I think what's really, really important is this part right here, which is for breast cancer risk reduction and for cancer risk reduction in general, you want to eat a diet that's rich in whole grains and vegetables and fruits and beans, nuts and seeds. And the way I like to teach my children is we eat the rainbow. And when you're eating a rainbow, you're already prioritizing a diet rich in all of those things I just mentioned. And so it's going to give you a lot of fiber, and fiber we know is associated with a reduced risk of breast cancer, reducing risk of breast cancer. But then we also know that you're going to get a lot of cancer fighting phytochemicals like antioxidants. So it's the best dietary pattern to follow when it comes to cancer risk reduction. And then the last one is breastfeeding. I'm very careful when I talk about breastfeeding because I come from a community of women who, you know, have these genetic mutations, and some of them choose to do these prophylactic surgeries before they have children and are able to breastfeed. And so I always say, for when it comes to breastfeeding, if and when you can, we know that it has been linked to reducing risk of breast cancer. I get asked a lot, what is the best exercise or the best food when it comes to breast cancer risk reduction? And while there is a list of things that I can tell you, the answer is really the best exercise is the one that you're actually going to do, and the best plant-based food is the one that you're going to eat. And then, of course, don't let perfection be the enemy of your progress. So every day is a new day for you to implement any one of these things for your health. Overall, how are we doing on time? Okay, so overall, when you look at risk assessment, so I think number one, what's really important is to have a complete and comprehensive family history, including a maternal and paternal family history. So a lot of times people just think that they're getting their like the BRCA gene only comes from my mom's side, but what's important to know is that you can get it from your mom or from your dad. So it's important to get a history from both sides of the family. So you want to ask who, what, and when. So who had the cancer, what kind of cancer did they have, what age were they diagnosed at? And so if you start to find that there is a pattern in your family where there's a lot of people diagnosed either with the same cancer or different kinds of cancers, it could suggest some sort of, genetic predisposition. And so that's when you would go talk to a genetic counselor and they can help you map out a family tree and all of that. And I would just, wanted to point out something specifically for women of color. African Americans and South Asians and Hispanics make for a very small number of hereditary breast cancers. However, I don't think it's necessarily because we don't get hereditary cancers. I think because There's a lack of screening, religious, cultural taboos, body image expectations, and just incomplete family histories. At least speaking from my Indian background, it was extremely difficult to try to figure out who had what and where. Someone had some sort of cancer in their stomach, and like nobody talks in details. It's very like no one likes to talk about cancer. So I think that is kind of why we see an underprevalence or an underestimation. So it's really, really important to spread awareness and advocate for these populations as well. And then we have specific breast cancer risk assessment tools that you can talk to an oncologist or genetic counselor about. And then, of course, we just talked about lifestyle modifications. Okay. So then in 2020, back to me, I ended up having a preventative bilateral mastectomy with aesthetic flat closure and a total hysterectomy, all at the same time, putting me in surgical menopause. So today I'm 35, 3 years after major surgery, having 2 kids and having been a palliative care physician, married to a critical care physician during the worst global pandemic of our time. And I can tell you that I have never known a better version of myself. And so much of that is because of lifestyle medicine. And so what did the 35-year-old version of me learn that the 26-year-old version of me did not know? And it started with this book, and we read this book over and over again to our children during the pandemic, especially at the beginning, because my husband actually had moved out because he's an ICU physician and we didn't know what to expect. And there was a line in there that I'll read to you, and it says, "When I got face to face with my problem, I discovered something. My problem was not what I thought it was. I discovered that it held something beautiful inside. My problem held an opportunity for me to learn and to grow, to be brave and to do something." And what I realized from all of this is that the most amazing things and the biggest opportunities and the life-defining moments in our lives are often disguised as impossible situations. And at least for me, what I've noticed in my own experience is that this impossible situation of mine basically helped me rewrite my story and what my future will look like. And so here's what my biggest takeaways are. Number 1, food is medicine, movement is medicine, sleep is medicine, and your lifestyle is the most powerful medicine that has and ever will exist. And Dr. Dean Ornish, he's one of the fathers of lifestyle medicine, he says, genes may load the gun, but lifestyle has the potential to pull the trigger. And so while we can't control the genes that we were born with, we can control the switches that have the potential to turn on and off our genes. This is known as epigenetics. And some of the things that really influence our epigenetics are all the things that we talked about, things like diet and sleep and exercise. And again, as a palliative care physician who has seen so much suffering, I don't think I would ever have the words in my lifetime to describe the things that I have seen from the stories of my patients. And so what I can tell you is, despite all of the amazing medical advances we have today, and incredible, I am so grateful because I benefited from these medical advances. Despite all of that, what I can tell you is that it's the little changes in our lifestyle habits that are still the best and most powerful investments that we can make, not only to reduce our risk of chronic diseases like breast cancer and others, but also to improve our quality of life. And to remember that, when we get diagnosed with a disease, it doesn't just affect us, it affects our whole family. So you investing in your lifestyle and your health, it will create a ripple effect. It'll help everybody in your inner circle. Number 2, so there's incredible power in controlling what you can and making decisions followed by committed action. And we talked a little bit about this with the state management, but I've always looked at my genetic mutation as a blessing in disguise because, and this is maybe because of my stark, point of view in life from being a palliative care physician, because I got the knowledge and the opportunity to do something to reduce my risk of cancer that my mom and my patients didn't get. So in this case, what I've learned is that knowledge is not power, it's only potential power. So knowledge plus action is actually power. And COVID taught me that your whole life can turn upside down in an instant. And so the best time to do anything is right now. And taking action consistently on these little small habits, you'll be able to then control your mind. And if you can control your mind, then really anything you want to do in life is going to become possible for you, because it's not our will that stops us. It's our mind that always convinces us why we shouldn't do something. So if you can master that and take action and constantly show yourself that you can do this, you will be able to rise above any situation that you're in. At least that's my experience. And then lastly, have an abundance of gratitude over fear. And I think right now, with everything that's happening in the world, it can be really easy to slip into fear. And I think the antidote to fear is gratitude. You can't be fearful and grateful at the same time. And so it's important, especially in difficult times, to really focus on what you're grateful for and keep it really, really simple. The ability to walk, the ability to eat, the ability to be with your loved ones, or simply just waking up and being alive. These are some of the things that I've walked away from my patients' stories with. My patients' dying words of, I wish I could have loved more. I wish I spent more time with my family. I wish I pursued my passion. I wish I took care of my health. I wish I had more time to live. These are the stories that tell me that just simply being grateful every day for the opportunity to love and learn and grow and have my health and be alive is such a blessing. And so I hope I didn't go a little over, but I hope, a little piece of this story resonates with you. I know I went through this stuff really fast, but I hope that you are inspired to cultivate a lifestyle and a mindset that allows you to live your best life and make the most of this super short and precious life that we have all been gifted. So thank you. And I'll just put a little plug in for this book that I recently had the honor of co-authoring with 32 other lifestyle medicine board certified female physicians, called How Healers Heal. And it is a unique compilation of all of our personal stories and how lifestyle medicine changed our personal lives and now the lives of our families and patients. And it is basically a picture of what is coming in the future. I think lifestyle medicine is going to change our sick care system into a true healthcare system. So thank you for having me, and I'm so grateful. Oh, Rohini, you're muted.
I've only been doing this for about 3.5 years, but I got tingles hearing your story. I mean, I've heard you speak before, but it was so powerful. And thank you so much for sharing all your incredible wisdom and your entire journey. I know kind of every time one shares a journey, like that, it brings back so many feelings and things. But yeah, it's super inspiring to everyone. And I think, as you said, no human being is sort of protected from suffering. There is pain and suffering to be had, but there's also joy and wonderful things in equal measure. And I think just that reminder was really powerful. Obviously, all of these topics, sharing with people here who are mostly health professionals is one thing, but I was wondering how you share with your children. Are they too young to understand now? Do you have any thoughts about that for people who might have children and who might be wishing to share something about their health journey, or maybe they have breast cancer themselves?
I think that's always very unique to the child that you have, because I think every child is different. For me, when I went through my surgeries, my kids were 3 years old and 18 months old. And I remember my son, all he wanted to do was sit on top of me, and he couldn't because I had all my drains and everything. So he literally laid on the bed next to me and just held my hand for hours at a time. And my daughter, she would come and I would allow her to touch and feel and ask questions to the age appropriateness that it was. And I think, children are curious beings. And so answering their questions in an age appropriate way is probably the best approach. That's my approach. Right now in my personal life, we haven't really, my kids are now almost 7 and 5. We have not talked about BRCA or cancer or any of that yet, because we have decided to focus more on the things that they can actually control right now. So we really prioritize talking about, why we exercise and why we move our bodies and why we eat the rainbow. And we make our lifestyle a game about who can do more and what, why are we doing this? What is this doing to our body? So we kind of come at it from that perspective. In terms of the recommendation, my children do have each have a 50% increased risk of getting this genetic mutation. But in terms of the recommendation, is at age 18 is when you should really talk to them about considering testing because of informed consent. And because this is obviously a loaded piece of information. Once you you get a genetic mutation diagnosis, there's so much to take into account. And so they have to really have the ability to make informed decisions and weigh risks and benefits and all of that. So yeah, I would say knowing your child and what, their maturity level and all of that, their age, all of that matters.
Thank you so much for sharing that. Someone has asked about what your thoughts are on working kind of 8 hours a day at a desk, just like I do, just like probably many people who are here do. It's kind of sitting down all day and having these sort of sedentary desk jobs, even if you're exercising outside of that. What are your thoughts on that? And what can we do to minimize the risk and the harm?
Yeah, I mean, I think any movement is good movement. And I think there was actually a study done not long ago that showed, because if you look at the, before I say that, if you look at the recommendation, it's like 150 minutes of moderate intensity exercise, per week, or 75 minutes of vigorous intensity exercise is kind of the recommendation for exercise. Now that might not be possible for a lot of people for a lot of reasons. And so this study, I want to say it came out in 2020 or 2021, which showed that even as little as 10 minutes of movement at a time showed improvements in overall outcomes and all-cause mortality. So that's why I like the idea of do what you can when you can. Don't worry so much about the recommendations. You start where you are and you build yourself up. I work from home now as well. So I do palliative care telehealth. So I have a standing desk. Instead of a chair, I actually have a yoga, a yoga ball chair, if that makes sense, gosh, I don't know how to describe this, but I have one of these balls and it has a stand. And so it requires you to actively engage your core. And I have a balance board that I stand on. So anything where you're not slumping over and for 8 hours, setting a timer on your phone for every 30 minutes or an hour to get up and go outside for a walk, or, little things.
Just doing a little exercise snacks.
Yeah, exactly.
And by the way, everyone has said it was an amazing lecture, super inspiring, incredible. I think people have blown away, lots of lovely comments, which I will share with you afterwards.
Thank you so much.
And I know and with these webinars, when people are brave and vulnerable enough to share their story, it always really resonates, because I think health professionals sharing their story, there's just something very powerful about that. I think especially as people see health professionals as a little bit kind of separate, and like, are they actually dealing with the stuff we're dealing with? But actually, we know, we all can deal with these health conditions, and just raising awareness of that. So someone sort of just made a general point about kind of limiting stress and enjoying meditation, mindfulness, fresh air, as well as exercise, and sort of looking after our immune health in lots of different ways, which I think you touched on, that it's not just one thing. But are there any other tips that you have for stress management? I think so many of us do feel chronically stressed, certainly just even, switching on the news, or just pretty much anything, parking your car, just about anything can lead to kind of stress spikes throughout the day. Do you have any other tips for people?
I think the biggest thing that's been helpful for me is just constantly reminding myself that I have the ability to choose what I'm going to focus on. So what's always wrong is available, but so is what's right. And just constantly reminding yourself that, you have the ability to choose what you're going to think, and how, and what the situation means to you. And, how, like, what action you're going to take, like, that will give you back so much control over your life. And that's probably been the biggest game changer, because there's tons of tips, like, if you could have a gratitude journal, you could have a breathing practice, you could have a meditation practice. Like, there's a lot of things that we can do, but it all starts with what I say, wellness is a mindset. So there's a lot of things you can do, but it always starts with your thoughts and your focus and your mindset. So yeah.
Wonderful, thank you. You mentioned right at the beginning about, I think it was the American Institute of Cancer Research, that AICR. Why did they suggest not taking supplements for cancer prevention? And what supplements are they referring to? Because I know many people who are here are plant-based and taking B12. I mean, all of us should be taking vitamin D at this time of year in the UK, and probably some other supplements as well. Do you have any thoughts on that? And what is your view on supplements?
I mean, I think if you're following a vegan diet or a plant-based diet, there are certain supplements that we know we should take, like you mentioned, vitamin B12 and probably vitamin D, because to be honest, they should just put that in the water these days. I think everyone's vitamin D deficient. However, I think from the AICR standpoint, I think there's just not enough research to support the use of supplements specifically for cancer risk reduction. And I think you just have to be careful, because I think there's so many people out there trying to sell a cure to cancer. And I think the reality is that cancer is a very complex beast. And so there's not just one thing out there that is going to cure it or treat it or prevent it. And so looking at it from a holistic standpoint, that's why I like their wheel, because there's like many different things that are in your control. So I think the supplement piece is there's just not enough research to support it.
Thank you. And another question, this is a hot topic, was sort of the link between breast cancer and oral contraceptives. Do you know about the research in this area? Do you have any thoughts?
I will say that I am not an expert on that. I feel like I have personally read conflicting information, specifically speaking to like genetic mutation carriers, like myself. My understanding is that if you take sorry, it's my dog, oral contraceptives for 6 years, it actually can reduce your risk after the fact. However, how does that apply to the general population? I don't want to speak to that, because I feel like it's conflicting, everything that I've read. So I would probably defer that to an oncologist.
Yeah, I think that there's a lot of different research out there, and I think there's lots of different decisions that need to go into something like that, including someone's plans for fertility, for managing pain if they've got painful periods or something like that. So they've got to think of lots of different factors. And Someone would love to know about the different training into lifestyle medicine that you've done, and what did you find most beneficial or inspiring or impactful? Because this is an area that so many health professionals are now getting really interested in.
If you would ask my husband, he'll probably tell you I've done way too many. But gosh, I have loved almost every single certification that I have done. So after my surgery, after 6 weeks after my surgeries in 2020, I became board certified in lifestyle medicine. If you are a healthcare provider, not just a doctor, but a healthcare provider, that is 100% the first certification that I would recommend. It just opens your eyes, because as doctors and healthcare professionals, we really value evidence and science. And so it will just open your eyes to the power of lifestyle medicine, and all the pillars that we talked about. Like, there is so much science dating back to the 1990s and 1980s. Why it's not part of medical school curriculum, I don't know, but I can tell you that that's changing. So that's the first certification I would absolutely recommend. It's not just for doctors. After that, I think the missing link, and obviously there's only so much that I think doctors can do, but I think the missing link when it comes to lifestyle is that it's not just about the how, right? Like, we know there's all these things that we can do for our health. However, it really comes down to the why and the psychology behind behavior change. And so for me, the next thing that I pursued was a health and wellness coaching certification. So I'm a health and wellness coach, and that has kind of allowed me to, and on the side now, I've started my own coaching business and just a whole bunch of other things in helping particularly women at higher risk of cancer like myself to put some of these lifestyle things in practice. But I think a lot of it comes down to understanding a person's model of the world and their view on things and what is possible for them in this season of their life and their psychology and all of that. And then the next step is implementation of the lifestyle piece. So it's not just as easy as just telling someone to exercise, because there's probably so many things that may be limiting them from it. So you really have to understand all that. So the coaching was amazing. And for me, I really, really value cooking and plant-based nutrition. And so over the last 8 years, I've really mastered that art, and also, did some training there, and also became a culinary coach. Oh my God, I should stop talking because there's so much that I've done in the last 8 years.
I did see in your bio that you're a culinary coach. Perhaps you could share a little bit, what does kind of a day of eating look like for you? What's your style of eating? And this, by the way, is what Simran eats. It's not a recommendation to every single person here, but I'm just curious because I know that you're passionate about cooking and eating a plant-based diet.
So my husband and I, we went vegetarian in 2015 and then became vegan in 2018. And my children are fully plant-based since birth. And so it makes it very easy for me. I'm just pointing this out because, there's a lot of people out there who may be plant-based and their family is not, and that can make it more challenging. So I'm just framing that. It makes it much easier for me to be able to eat the way that we do. But in the mornings, most of the weeks, we're either having oatmeal with a whole bunch of fruits and nuts and seeds on top, a green smoothie, protein waffles that I make made out of oats and banana and soy milk. That's some sort of breakfast there. And then for lunch, probably some greens, a salad of some sort. And usually I do leftovers for lunch because I'm working, and it'll be like some grains or some sort of curry. And dinner is all sorts of things. We usually try to do something different every day of the week. Again, I love to cook, so this may not be possible for everybody, but I just love to cook. So we usually break it down by cuisine. So like I'm Indian, so I do a lot of Indian cooking. So we do Indian, and Tuesdays we'll do Mexican food, and then an American, so like we just do different types of cuisines for dinner. And I always cook extras. That's a big tip. And so we have leftovers the next day for lunch, and I freeze some for busy weeks. And my Instant Pot is my life. I cook almost 80% of my meals in my Instant Pot and my Vitamix. And yeah, So, and
thank you for sharing that. Also, yeah, lots of diversity there. And what's your thoughts on dairy? Dairy's kind of a controversial topic in the cancer space, and I was wondering what your thoughts are on dairy and breast cancer.
I think this is another area that's very conflicting when you look at the research. However, I think there are more and more studies linking, hormonal cancers to dairy. So things like breast cancer and prostate cancer. So I err on the side of avoiding it, not just for cancer risk reduction, but also for reduction of other chronic illnesses like heart disease. When you think about dairy, cheese is probably something that makes up majority of at least the American standard diet, and it's the #1 source of saturated fat. And so, like I mentioned, for heart disease, yes, but saturated fat foods high in saturated fat and cholesterol can all lead to body fat, excess body fat, and weight gain. And so indirectly, an excess of any of these things can, I think, increase your risk of breast cancer, whether there's a direct link or not.
Thank you for sharing that. And then one final question. There's been a lot of questions. We can't get through all of them, unfortunately, but I'm doing my best. And there's a question about a kind of mitochondrial function and disease, especially cancer. There's currently a lot of discussion in this area. What are your thoughts and experiences about that? How does one keep mitochondrial function optimal? And which lifestyle change, in your opinion, has the most positive impact on mitochondria?
So I love this question. I feel like I could probably talk about this for a really long time, because right now my next area of interest is really longevity medicine and understanding cellular health and ways to enhance cellular function, healing, rejuvenation. And a big part of, so the last 7 years have been all about the pillars of lifestyle medicine. And now some of the things that I'm starting to incorporate into my life for the last couple of years have been things like intermittent fasting, sauna use, cold therapy, and a lot of these things that we now know as hormetic stressors or hormesis, which are different ways of stressing our cells in a good way. So eustress, not bad stress, but eustress. And so these are all different ways of enhancing cellular function, getting rid of cellular debris, enhancing mitochondrial function, to combat the effects of aging from our environment and all of the things that stress out our cells and our bodies. So yeah, that's like a whole nother talk in and of itself, but there's so many really interesting things out there, I think, that we can do to enhance our cellular function and mitochondrial function.
Thank you so much. Sorry for the distraction at the end. I just wanted to launch our little poll before everyone disappears. But I just want to thank you so much, Simran. You've been absolutely amazing. And yeah, I don't think we've had a webinar quite like this before, which has had such a powerful story, and then so many practical tips that I personally have really benefited from. I think, it just, even if you know a lot about lifestyle medicine, there's just been loads in here to take away and start applying, and super engaging, as someone's just said. And yeah, thanks a million. And I think lots of people will watch this as well on catch up and hopefully share it. So thank you so much for being here and making time to do this. And this is also Breast Cancer Awareness Month this October. So I think there's never a better time to kind of share this with people you love. We also have loads of resources at Plant-Based Health Professionals UK. We have lots of fact sheets on cancer prevention. If you go to pvhp.uk/fact sheets, and Dr. Shireen Kassam, our founder and director, has done lots of wonderful talks and previous webinars on this topic. And Simran, how can everyone, I follow you on Instagram, and I know I always see you on your bike and working out and just being super inspiring. Just remind everyone where they can find you again. I've already shared the link, the UK link to your book in the notes, but just remind everyone.
Yeah, my website's simranmd.com. And then on Instagram, I'm drsimran.malhotra. So you can find me in those two places, and I just can't find the time for the million other social media channels. So that's where
I know, I feel like there's a new one every day. It's a bit hard to keep up, but just do a few. Okay, I think that's it. But yeah, thank you. And there's also, I did notice that out of the people that joined, about a third of the attendees were men or had male names, and that's wonderful, because often we do talks relating to things like breast cancer or women's health, and it is predominantly women only. But this is something, as you said at the start, men can and do get breast cancer, and they certainly often will have someone in their life, a loved one, a partner, a friend, employee, a colleague, someone around them who is going through breast cancer. So it's really important that everyone knows about this. Okay, wonderful. Well, we'll wrap up there. It's about 8 p.m. in the UK, so I'll let everyone start winding down for the evening. But thank you so much, and good night, everyone, and see you next month for the talk on weight management. Thank you, Simran, again.